So to understand how to manage the blood pressure, high blood pressure, you have to understand actually what regulates the blood pressure. Like what are the things that affect our blood pressure? If you look at the mechanics, um, how the blood pressure like is regulated, a lot of it depends upon the viscosity. Viscosity means the thickness of the blood, and the resistance. Resistance is how much pressure is there around the blood vessels, and uh, it also depends upon how fast your heart is pumping, how much volume is there in the blood circulation, and your stiffness of the blood vessels. Like what we found, like in summary, your blood pressure is regulated by the thickness or the viscosity of the blood, the stiffness of the blood vessels, how stiff your blood vessels are, and how narrow your blood vessel is. And there are factors in the nervous system that affect your blood pressure, and different hormones as well. So we will be looking at all these things. Like in our presentation, we'll be looking at how you can adjust the thickness or the viscosity of your blood, how you can adjust the stiffness of your blood, and how you could adjust focus on the changing the lumen or the size of your blood vessel. All these things that we'll be looking at.
Yeah. So like if you can see simply, I mean, there are only three things that can actually cause high blood pressure. Either it could be due to the mechanical factors, or it could be due to the nervous system or the neural factors, or it could be due to hormonal factors. So like one by one, we will see like how we like what things actually cause or increase blood pressure. So like in the beginning, when we talk about the mechanical factors, so you can see that one is the viscosity of the blood. So here our goal is to address the root cause of what are the things that are causing high blood pressure. So for now, you could see that these are the things causing high blood pressure. And when we address the root cause, so when we are able to address the things that can actually decrease the viscosity of our blood, that can actually decrease the stiffness of our blood vessels, that can actually decrease the peripheral resistance, that's when we are able to decrease the blood pressure. So like, that's why you will see like we are addressing a lot of lifestyle factors. So there are some things. So when we focus on diet, when we focus on foods that decrease the blood viscosity, that decrease the stiffening of arteries, similarly, exercise, it increases the size of our blood vessels. And when we take care of our body weight, so increased body weight increases the peripheral resistance of the blood vessels. And there are some foods, for example, alcohol, which increase our blood pressure. So when we take care, when we address the lifestyle factors, we see that there is huge change in blood pressure.
So the bottom line is basically high blood pressure is a lifestyle disease. It is not how many of you think it's actually a genetic problem? Like, many of us are into believing that high blood pressure is mostly genetic. Genes may be responsible for 5 to 10%, but 85 to 90% of high blood pressure and other chronic diseases that we see, these are lifestyle factors. And we look at individually, like, how each one of these affects. Like if you look at food, how does food affect the blood pressure? So food affects all three mechanical things. Well, we said the three mechanical things are: one is the thickness of the blood, and the stiffness of the blood vessel, and the size of the blood vessel. So let's take a look. Like, so if you look at this picture, this is where our art skills come in. Like, what do you think this is?
Artery.
Artery, yeah. So it's and this is you guessed it right. It's a blood vessel or an artery. The beautiful thing about these arteries or blood vessels, these are very similar to pipes. Like it's a plumbing, like all the water pipes that you have in your house, The blood vessels are similar to the pipes, and the pressure in the pipes depends upon how uh, how the flowing, whatever that is flowing in it, is whether it is thin or thick, and also the stiffness of that pipe. The What happens is, like with different foods that we eat, this fat gets deposited. Like what you're seeing here, it's like all this yellow is the fat getting deposited on the blood vessel wall. There is actually a technical term that we use. This is called atherosclerosis. Atherosclerosis means stiffening of the blood vessels. Do you know what causes this stiffening of the blood vessels? It's this deposition of this fat. It's the food. The more butter, chicken, cheese, eggs, turkey, beef, pork, oils, even moose, like the more of these foods that we eat, there is more fat deposition on the blood vessel wall, and also there is more fat within the blood itself. So when you eat these foods, what happens is your blood, instead of flowing like a nice thin vinegar, your blood flows like ketchup or barbecue sauce. It's so thick. And when the viscosity or the thickness of the blood goes up, the pressure that is needed to maintain the flow, the body has to work hard, so the pressure goes up. When the stiffness of the blood vessel increases, the pressure increases. Other thing is, as more and more fat gets deposited, the more and more fat gets deposited, the lumen, or the size of the blood, the area that is there for the blood to flow, it decreases. So as the size decreases, even the pressure goes up. I mean, this is a wonderful demonstration. Like basically, in the smaller blood vessel versus a larger blood vessel, the flow is much faster. Like in a larger blood vessel, you see the flow is so easy and smooth. Whereas in a smaller blood vessel, the body has to work hard. The pressure has to be much more to maintain the flow. So these are the three ways how like the food affects your blood pressure, and this happens very quick. Like you might think, okay, if you had a breakfast or lunch or supper, how long, like within the moment you eat the food, within 30 minutes your blood vessels start to change. Within 30 minutes,
your blood thickness,
the blood thickness and the blood vessel stiffness starts to change within 30 minutes. And that stiffness of the blood vessel and thickness of the blood, it lasts for almost 6 hours. So if you're eating a meal of like butter or eggs for breakfast, and then for lunch you happen to have a cheese and chicken, and for supper you had some pork chops or shake and bake chicken or whatever, or turkey soup, that's 3 hits for 3 insults or damages for your blood vessels that they haven't recovered from the last one.